And here we are joined by our panel of people for our mental health discussion. I'm joined here by Dr. Cindy Stone. She's the Community Care Physicians Director of Integrated Behavioral Health Practice. We've also got Tawana Davis here from Russell Sage College, where she's the Associate VP for Student Life for Student Wellness. She's also the co-chair of Sage Thrive, which is a college-wide initiative to promote well-being. And then we've got Sharon Horton here as well. She's here to share some of her personal story about a loved one who has a mental illness and who can speak a little bit from that perspective. So first of all, thank you all for being here to talk about this very important topic today. I just want to start off by opening up the floor to all of you. You're all in the community in different ways, speaking with different people, different issues. What are you seeing as some of the biggest mental health or mental illness issues right now out there?
Yeah, so that's a great question. One of the things that we see, I mean, there's obviously a lot of issues, but one of the biggest things that we see at Community Care Physicians is just trying to improve access to care. Access to care is just a really huge part, that people get the care when they need, and also remove the barriers to care, and normalizing it for people, that it's just as important as physical health, and acknowledging that and being able to get the care you need in a timely period of time.
Right, because stigma is such an issue, as we all know, when it comes to mental health and mental illness.
Right.
What about for you, Tawana and Sharon?
Hi, Lara. So really one of the biggest issues, as you just said, is stigma. When people come to a college campus, they just want to be well, and they want to have fun, and they really want to just be normal, you know, the normal. And then when they're realizing that, hey, I may need a little bit of help, it's like, how do I seek it? That barrier of how do I seek it? What do I do? They don't have a parent there to navigate that for them. So it's first determining how do I get there, and then when they do decide that they do need that treatment, it's like, ugh, I need the treatment. So they determine that they need the treatment, then they figure it out, but then it's like, do I actually want to get it? And so then the next piece of that is, okay, so I need the treatment. And we have it readily available, but it's like you have to walk down that long hallway to get it.
Yeah.
And they think everybody knows what they're doing. And people don't know because it's confidential.
Right.
So it's really getting people to go and get that treatment. So it really is a stigma of getting that treatment.
Yeah. Sharon, what do you see?
Yeah, I mean, I obviously see both of those things too, but I think from a family perspective, it is really about supporting the person, the whole person, and involving the family or their support system in their care. I think that's a great barrier that I've experienced in my past with my loved one, is that, you know, once they have access treatment, it's really hard for the family members to support them in that, to get communication with the treatment team, even when there is a release signed. So I think it's just, for me, the barrier is involving the whole support system.
Yeah.
Yeah, I think that's a great point, because when we think of whole person care, we think of combining the mental and the physical.
Yep.
But I think including the family and the support system is a huge part of that.
It is a huge part of it, yeah. And Dr. Stone, I know that this practice, this behavioral health practice, is a little bit new and different. Can you talk a little bit about the work that you're doing at CCP right now?
Yeah, another great question. So it is, you know, integrated care is new in the sense that it's just kind of awakening across the nation, right? As far as timeline, it's really not new. Forms of integrated care started as late as the 80s. We've been in existence since about 2013 at Community Care, and pretty rapidly increasing our program and growing it, and not intentionally. It basically just grows by itself.
Yeah.
So the real premise of it is whole person care, that nobody is siloed, and family is involved, and the medical providers are involved, and the behavioral health providers are involved, and other members of the care team, maybe a nurse care manager, things like that. And we know that when we have all these different variables involved in the patient's care, that A, patients get better faster, which is the best news ever.
Yeah.
And B is, you know, we can prove this with outcomes.
Yeah.
I mean, we've seen such tremendous increase in our data with patient outcomes. It's just truly amazing. And, you know, it's I could talk forever, and I certainly am not going to do that. But one thing that we do find also, and this is just really important, it increases patient satisfaction, which then increases patient adherence to treatment, whether it's medical or behavioral. And again, without treatment, people can't get better faster, so.
Yeah, and it seems like such a small thing, but I think we all know you go to one doctor's office, then you go to another, and you have to call both offices to see if one passed along the blood work to the other one, and it's like a whole thing. So when you're all working together, it does, I would imagine, make it much easier.
And that's honestly the beauty of it. You
Yeah.
hit the nail on their head, because literally you can go in to see your PCP for a sore throat, and you might have other things going on in your life. Like, let's say your mom just had some incident, and, you know, you're caring for your adult, you know, your older mom, and you're very distressed and upset about it. Is it a mental health issue? No, but it's definitely a significant stressor. So you tell this to your primary care provider, and they can literally walk you down the hall to somebody who can help you kind of deal with that stress.
Yeah, that's great.
So.
Tawana, I wanted to talk to you a little bit about Sage Thrive, and especially, you know, doing this work on a college campus. I think a lot of us know, but maybe not everybody knows, that a lot of mental illness and mental health issues start to spark when people are at that college age, that adolescent age, right?
Yeah, so it happens, and it happens right when they're leaving home. So they come to college, and they're like, what is going on with me? And at first, I think it's probably a little bit of homesickness, and it can be. It can start with that homesick. I'm a little bit homesick. I'm missing my family, and that might be the first trigger. And then it's, I don't have any friends, because guess what? You know, in school, you had your family to make your friends, and then you already had that natural group of friends, and then you get to school and you don't have any friends, and you don't know a way to make friends. So that could be another trigger. And then you were in school, and your academics just came naturally. Now you get to college, academics aren't coming naturally. So it's like all these building blocks, it's like the perfect calamity of errors that's gonna come.
Yeah.
And then it just starts to spiral from there. And students are like, what do I do now? So with Thrive, we are trying to work on the 8 dimensions of wellness, because it's not just one dimension that happens. It's like all these things that are falling into place that are not working well for you. So we find that if we work on all of the dimensions, and you don't have to improve on all of the 8 dimensions of wellness at the same time, because that's impossible. But if you work on one dimension at a time, improving that one dimension, then it will help. And, you know, mental health is in there.
Yeah.
So is financial. So is environmental. So is, you know, there's so many other different 8 dimensions that you can actually work on. And we find that that does help improve that mental health for students.
Yeah.
And then they do start to seek for help, and they start to look for the programs. Hey, are you doing one of those other programs at Thrive? And it's like, I am. You want to help out? So they do start to seek that help, and they do start to say, I do need to start improving my mental health. I do need to improve my financial health. I do need to do this. I do want to do something around sustainability. So.
Keeping the focus kind of on this age group, or maybe not, but I wanted to open it up to all of you, talking about how the influence of others can have such an impact. And this means everything from social media to bullying to even just when you're in in-person rehab or something, and you're mirroring what you're seeing other people doing, even if they're not the best habits. I would love to hear what each of you has to say about that.
I guess I want to just mention and respond to what you were saying about all those factors, those dimensions. You know, I think it's really important to note that there's so many factors involved in mental health, and certainly, you know, there's a difference between, you know, mental health and serious mental illness too. So I just want to delineate that, and that, you know, those factors of, you know, financial health, and whether you're struggling with friends, and whether you're, you know, struggling with adapting to school, or whether it's a family problem. I think all those factors, societal factors especially, can lead into, you know, a decline of that mental health state. So,
Yeah.
Yeah. Yeah, I think that's really important that we do look at all the factors. So all that is really great. You know, this is such a challenging age because people within that age group tend to be, you know, they're trying to reach out for autonomy, separating from home, separating from parents. And, you know, parents were kind of the role model for childhood, right? So now we look for role models amongst us. And, you know, with the bombarding of social media and pressure, peer pressure, all those things, it has a really tremendous influence. And then sometimes it can be a good influence for our teens and our young adults. But a lot of times, unfortunately, it's not.
Yeah.
So I think treatment that involves, you know, really working with that person individually to help them understand that really they're okay who they are, and help them to develop who they are and not compare themselves to other people and try to be somebody else or think that, you know, this person on social media is better than them because they have more friends or more likes or whatever, is just a really important part of that process.
And I think that applies not just to adolescents, but to anybody of any age, right?
Because you can have
Be
those
clear
same
here.
problems in your 80s.
Exactly, exactly.
I think that we're not telling them enough that when they're looking at social media, they're looking at a curated lifestyle.
Right.
You know, it's something that somebody has really worked hard at to make sure that this is what people are seeing. It's not what people are living. And you're never going to live up to that.
Yeah, yeah. It's perfectly edited.
Yes,
Social media, that's a whole other
exactly.
rabbit hole
Or
you
it's
could go
selectively
down.
shared, right?
Yes, exactly. Well, and Sharon, you brought up an interesting point that I did want to touch on too. There is a distinction here between mental health and mental illness. So I don't know if you'd like to speak to that a little bit.
Well, I mean, I can speak from my own personal knowledge, and I won't speak from, you know, professional standpoint, but the fact that there are serious mental illnesses such as schizophrenia and bipolar, which my son lives with, that are debilitating to one's life. And I think that for me, the distinction is that, right? When a serious mental illness is a mental illness that is debilitating to your life, and that affects your whole person in every aspect of your life. And it may be something you live with always. Whereas, you know, mental health issues we all have, you know, and some of us have more extreme, you know, experiences with that than others. Typically, from my perspective, those are come in waves. And Dr. Stone, you can expand on this, but I feel like it's important to know that it's normal to feel depressed, and it's normal to feel anxious when you're, you know, in front of an audience, or those kind of things are very normal. And I think normalizing that is important for us, that we can share and we can bind in those experiences. Whereas, you know, also understanding that people who live with serious mental illness really need supports, and they need understanding, I think, from society as a whole, that their disease is as important and should be treated as such as a physical disease, diabetes, heart disease. You know, I think, you know, from my perspective, that we have a long way to go there in normalizing and equating healthcare to where we need to go.
And the effects that it can have on families.
And the effects that it can have on families.
And not only families, but the other people around them.
I mean, that's a huge thing, right? And then I brought up support systems in the beginning, and that, you know, part of being a support system is also feeling like you can help and that you can support, rather than feeling hopeless, like you have to just, you know, listen to what everybody's saying and kind of, you know, stand behind closed doors. I think it's very empowering for families and those in one support system to be part of that, to understand it, to become educated. I'm a big proponent of educating yourself about whatever it is you're facing, whether it's a physical ailment or whether it's a mental health related issue, that you become empowered as a family member so that you can best support your loved one through that.
And empowered and educated, right? I think that's a big part of it. You know, I think these are great points, and serious mental illness, there is a differentiation there, right? And I think we can't talk more about, again, we go back to mental health is just as important as physical health, but we can't talk about it, we have to do something about it.
Correct.
Right? And especially in the sense of serious and persistent mental illness, we need to really, across the board, make that the same, just like you're saying, as any other chronic disease. One of the things I am so passionate about integrated behavioral health for is because it's one of its main goals is to do that.
Yeah.
Is to really normalize behavioral health, whether it's serious and persistent mental illness or whether it's a behavioral health issue, like I just mentioned, like a life stressor.
Right.
And to normalize it that it's okay. It's absolutely, you know, it's okay that, or maybe it's not okay, but this is happening in the case of serious and persistent mental illness. And, you know, we need to educate and we need to support the family, the person, as much as we possibly can.
Yeah, and break down that shame. I'm sorry.
Yeah, no, go ahead.
And
break down that shame
absolutely.
behind it, because I think that is for families as well. Many families isolate and suffer in silence.
Yep.
They don't share it with their own family even because they're ashamed of what's happening with their loved one. Or if I am one living with a serious mental illness, I'm ashamed to get help. You mentioned that about the students. I'm sorry about
So
that.
But I think that when we have that barrier of it not being integrated, the barrier is created when, because of it not being integrated, there is no care. You know, that there is not a care provider. When it's integrated, just as you said, you can walk down the hall and get care. If it's not integrated, it takes months and months to get into a provider.
Right.
And you're doing your referrals, you're trying to find a provider, but students nor people in the community can find a care provider. It is very hard to get a referral and get people to be seen.
And that was my point with access. A lot of times in our community, it's 3 to 6 months between need and actual seeing somebody.
And then even when you do see somebody, you might have a doctor that's writing off some aspect of what you're trying to talk to them about. They think it's, oh, you're just anxious. But maybe they're not just anxious. Maybe there's something more going on there. And then, I mean, what do you recommend that people do in a situation like that where you feel like maybe the doctor is writing me or my loved one off?
Advocate.
Yeah, right?
Advocate. And I feel really strongly about this. I have an experience with my mom when my mom was going through cancer treatments, and she kind of taught me this. So, you know, thank you, Mom. She's in heaven now. But to take a notebook in with you to your doctor's appointments. Always bring somebody with you. It doesn't have to be a serious thing, but bring someone with you to the doctor so they can write down a few questions, or they can write down a few answers. They can write down what's being said, because when you're in the moment, you forget to ask the question you wanted to ask. You forget to, you know, what the doctor told you to do or how they told you to sleep or whatever. Like, you forget. So having someone there with you who's advocating and supporting you, as well as being an advocate and support for someone going through something, mental illness or physical as well.
Absolutely. And just to add on to that, you know, ask questions.
Yep.
Yes.
Right? Like when you're in that doctor's visit, ask questions. Your doctor will, you know, will answer, but can't answer unless you ask, right?
Yeah.
So bring the notebook, you know, have things you want to do, but as things come up in the visit, inquire about it.
Right.
I always say, and don't be afraid to ask for a second opinion.
Yeah.
If you don't like your provider, there is always another provider.
That's true.
Sometimes you and that provider will not jive.
Yeah. Trust your gut.
Yes. Yes. Trust your gut.
Trust your gut. Yeah.
Trust your gut.
Dr. Stone, you have the beauty of you're working in an integrated space, which we were just touching on a little bit here. I mean, what about people who they're going to a doctor's office and it's not so integrated, and they're there for one thing, and you know, maybe there's a physical component that starts to spring up, but there's still a mental component, and getting all of the care that you need, making it a holistic thing. How can people go about doing that? It's hard, I would imagine.
Come to us.
Yeah, exactly.
Because
what you're doing is should not actually be hard. It
shouldn't be hard, but
be.
you know, interestingly, data now supports, and this is a couple of years old, so I'm sure it's increased since then, but 70% of primary care visits are psychosocially driven. 70%.
Wow.
So to your point, you go to your doctors, there's other things involved, right? So obviously the best thing to do is to try to just get your patient connected through more of a cold handoff rather than saying, you know, here's a couple of mental health providers, good luck.
Right.
Right. So try to get connected, and also have I guess I would encourage the patient to inquire of their doctor, is there anybody that you could recommend me to or refer me to, or any way I could get some help with this?
And then doing your own research, right? Doing your own digging to find out where there is access to the care that you need, I think is important to be your own advocate. I'm going to say that again and again because from a family standpoint and being through what I've been through with my son, he would have never taken those steps.
Yeah.
He couldn't physically and emotionally take those steps. So making calls and you know, diving into the internet to learn about the disease or join a support group to understand. I just think like knowledge is power. You have to do your research. Don't just stop at, I didn't really feel good about that interaction at the hospital or my doctor's office or whatever. Dig in, see what more you can find, because there are resources. We're learning and we're getting better. This is so exciting, what you're doing. It makes me emotional because I didn't have that with my son 15 and 20 years ago, right? This has exploded in the last 5 years, thank you to the pandemic. But people are talking about it. We're opening up conversations about it. We're actually seeing movement and care. It's exciting. It's exciting for me to see as a family member, and so there's more resources than there's ever been before.
Yeah, that's great news. I love to hear that you're so excited. I'm really sorry that it wasn't available for you, but I love to hear your excitement now. And I think one of the important things, too, about integrated care is you were such an advocate in your family for your son, right? And that is huge. That's important, and we need that. But one of the great things about integrated care is you have now a team behind you also advocating for your son, right?
Amazing.
And it takes a village.
It's a hard thing to navigate,
it's
you know?
extremely hard.
And when you're first starting in that space, it could be the onset when they're 22, 25, or it could be from childhood. But most oftentimes, the parents don't know what they're dealing with. They have no clue where to start and how to navigate it. And then the system is oftentimes really hard to navigate through. So having those supports is critical. Do I have a minute?
Yeah, sure.
I just wanted to share one success, one win that my son and I had, our family had, was with the ACT team. It's Assertive Community Treatment. You may have heard of it. And that team approach, that multidisciplinary approach, the person-centered approach, the recovery-oriented approach, is what saved his life. Because he had a team of people around him who were keeping an eye out, right? And they were communicating with me. And I was communicating with them. If I saw something of concern, I would communicate. If they did, they would communicate. And so we've had this circle of support around him that's been hands down a life changer.
Yeah, it is a life changer. And, you know, I think one more point that we have to bring up is, as the family is advocating, you're going through a lot as well. So I think one of the other important factors is providing support for the family while they're providing support for the
Thank you.
The family member.
Thank you. I'll do a plug for NAMI. NAMI has great support groups, family support and individual support groups. So accessing those, that was also a life changer for me when I joined a community of people who understood what I was going through.
I just want to touch on one more thing before we move on, which is, and I don't know how much you guys can speak to this, but guardianship. When does that come up? Because that is a challenge, you know, when a person reaches 18 or older, but you realize they need more help, and that's tough. Can any of you speak to?
I mean, I can. I've had experience with that. You know, I think it's having that clear communication with your loved one when they're well, and understanding that this is how we work together to help you get better. Is being able to sign those releases. I did have a guardianship document drawn up for my son. He was on board with it, of course, and you know, I think it's really important to involve your loved one in the process too. Like that he is part of that plan. He's part of the crisis plan. He's part of you know, the release of information. That's all what he's a part of when he's well. Because sometimes when he's not well, it's not.
Right, because you can
she is not well.
Bring a horse to water, but you can't force it to drink.
Correct.
Right. So they need to be on board a little bit in order to make that happen.
Yeah. So I think, I mean, and I think those things are important because and I'm not talking about, I'm just talking my own experience with someone who was living with a serious mental illness that debilitated his life. When he wasn't well, he couldn't understand why that was needed, or he couldn't understand, what the foundation of having support system involved meant to him. So
Yeah.
I think that's important to note too. Like, do it when you're in a good place.
Right,
It's just
right.
like when you want to talk to your husband about something really difficult. Like, don't do it when he comes in the door after work. Like, wait till you guys are like in a good place.
Yeah.
But I think that even before you get to guardianship, there are some things that you can do for your loved one prior to getting to guardianship.
Yes.
You know?
Yeah, that's an
Even-
extreme.
Yes, that's the extreme case. But even before then, when they're in the hospital, you can still ask them, hey, you're in the hospital, you're getting treatment. Can you put me down as the person who can check in on you? So guardianship is at the very end of the extreme, at that extreme end. What can you do for your loved one prior to getting
Before there.
Yeah.
Absolutely.
We've talked about some of the advances that have been made in mental health and mental illness in the last couple of years, but where are some of the areas that you would still like to see changes being made? And do you have any ideas of like what we can do as a society to try and make those changes happen?
I think that people are always talking about, everybody needs to be CPR and first aid trained. Everybody should get that, and you hear it talked about. I think everybody needs to really concentrate on getting mental health first aid training. And it's not because I want to get rid of all social workers and mental health counselors. Mental health first aid training really does help people recognize the signs and symptoms of when somebody is struggling. And it allows them to have those tools to say, hey, I need you to get somewhere. Hey, I need you to figure out what resources are out there in the community. It allows us to have more people in the community who are trained advocates, who understand what is going on with people mentally. We talked about physical care. We also need to talk about that mental care that people need.
I think
That
that's
term
really
mental health first aid is something I've never even heard. So that just goes to show you like where we're at with that.
There's a lot of free training for mental health first aid trainers.
Yeah.
Yes. There's lots of mental health first aid trainers in our area.
Yeah. I would love to see everybody in our society or our world be trained in CPR and mental health first aid.
Yes.
That would be great.
Yeah.
Yeah, and I think that's, great point. That's a great program, and it really educates people on how to deal with different situations that could be related to mental health. But I think even a broader way is just education. Like, let's educate people more that this, in most cases, is a normal part of life. I read something just a couple of days ago. If you don't experience a behavioral health, mental health problem in your life, you're probably not human. All right? So let's educate people that this is normal. I mean, even in today's society, I have people coming to me, we have people coming to us that, will say things like, you'll normalize what they're going through, and they'll say, oh, so I'm not crazy?
Yeah.
And you're like, no. This is a normal result of what you've been experiencing.
Right. In
And
fact,
it's okay if you are.
Yeah.
If you are feeling that way, it's okay.
Right, but once
know?
they're, even from I think, like a community perspective or even a patient perspective, if the patient understands how what they've been going through links to what they're experiencing, then they realize it's normal.
Right.
And would you rather feel normal or crazy, right?
Right,
So
exactly.
I think it
everybody
comes down
wants
to
understand
community
that.
too. Like you touched on that community, and we touched on, breaking down the stigma and the shame. And I really think that does come back to community.
Yep.
I feel like I've had this conversation just around dinner tables, I don't know how many times, but when I grew up, I felt part of a community, right? I grew up in a kind of a smallish community. My neighbors down the street knew who I was. They knew who my mom was. They'd watch out for us. I feel like we've gone a little bit the other way, and now our community is finger pointing, right?
Yes.
Like there's not as much like care and community concern about the kids in our community. Are we all watching out for them? Like you said, it takes a village, right? Where's that concept? I would love to see that concept of rallying the village.
Yeah, people don't know their
around each
neighbors
other.
anymore like they used to,
So I think
Yeah.
that breakdown has really contributed to a lot of the shame and the stigma of anything. If anybody's ever out of the normal, you know, we're quick to judge, and so I'd love to see that. Please understand first.
And I think
rather than
that's
judge.
like the perfect world, right? Getting the communities back. But I think, you know, one thing again about more of team-based whole person care is that it forms a community around the patient. Right.
Yeah, their own
I mean,
personal
we'd like
community.
the whole community to be involved.
That's
to your
where we
point,
start.
right?
Yeah.
But at least we're starting somewhere.
Yeah.
And maybe it's kind of like, you know, lead by example, right?
Yeah,
so
that's
maybe
where
it
we
will
start.
trickle down. I love that kind of trickle. It's kind of when you were talking about all the different areas you work with, one trickles into the other, right? And a lot of times in mental health, we see that trickle down effect, which is the really cool thing. Because let's face it, each one of us can't do everything.
Yeah.
We do as much as we can, but we can't do it all.
Yeah.
And we also need to normalize getting help early. You know, I
Yeah.
think that sometimes people believe you have to be in crisis. The only people that go and talk to a therapist are, I'm experiencing absolute crisis. My life is going absolutely wrong, and that's when I need to go seek out a therapist.
Yeah,
it's not. It's I'm having an issue. I need some talk therapy. I got a referral. I'm going to go talk to somebody. That's when you should be doing it prior to being in crisis, because at crisis time it's not as effective. It's more effective before you get to the crisis point. So we need to normalize it then.
Right, and we'd rather not have people experiencing crisis, right?
Yeah.
Right. We want to
Yes.
prevent that from even happening.
Yeah, right.
Yeah.
I mean, one of the great things, again, opening up with some of the newer techniques bringing into mental health is preventative screening. So we do depression screenings, anxiety screenings, so we can hopefully catch things at an earlier point. Some patients will talk about it more openly, but others won't. So we can catch the patients that might be experiencing milder symptoms of depression, anxiety, PTSD, childhood trauma earlier to work on it before it escalates.
Yeah.
Absolutely.
I just want to thank you all so much for being here today. This was, I thought, a fabulous discussion and so, so important. May is Mental Health Awareness Month, and I think it's really important to be having this conversation, especially now. So thank you all again.
Thank you for having
Thank
this
you.
important conversation.
Yeah,
It was
yeah.
great.